On the 8th of October, we received reported suspected cases of what we now confirm is cholera in Guntao Primary Healthcare Center in Renk. That is Upper Nile state. And the suspected cases were mainly from the people who are crossing over from Sudan side. We collected the samples. They were tested here at our National Public Health Lab using culture. And out of the 33 samples up to date, 6 of those samples have been confirmed positive. And also there is a lot of community reporting of cholera that is going on. So until now, all those 6 individuals that were confirmed positive are treated and are gone back to their homes.
Talk to us about any potential spread of this cholera. I mean, cholera is contagious and it's raining in South Sudan. The cross-border activities are ongoing. What are the potentials that this could spread to places like Malakal, densely populated?
Cholera, unfortunately, it is a waterborne disease, and right now South Sudan is experiencing high volume of flooding, especially in the northern belt and central belt of the country, and the conditions that breed some diseases like that are very high, because one of it is the congestion of the people at the border. As I mentioned, it is one of our busiest crossing point from Sudan to South Sudan. And then number 2, we have got a huge volume of refugees and returnees that came due to the conflict of Sudan from last year. And then number 3, our amenities, services in those areas are very limited. As you know, the government has responded. From last year, the government of South Sudan has been responding, but the volume of people coming in is actually too much. And now we have got issues of the road that have been washed out. So before the government of South Sudan, with coordination, that is the coordination mechanism between the humanitarian affairs, the Ministry of Health, and all the involved institutions, we used to transport people on the road to ease the pressure. But due to the flooding, most of the roads are cut off. So of course, yes, we have to take a lot of precautions. Like today, when I mentioned that we have to follow guidelines, to prevent and guideline to take measures against cholera, as I mentioned today in the declaration.
Some of the guidelines are clear: wash your hands, wash your vegetables, and eat hot food, which are pretty simple. Let's talk about the national response to prevent this from spreading across the country. Could you bring us up to speed on that front?
At the moment, if you remember very well, John Tanza, beginning of the year, around March, April, there was another declaration that I did on behalf of the Minister of Education when we had heat wave. And at that time, because we are the technical institution, we had already projected that because of the volume of the water that we are going to get, we will expect like what we are expecting today. So my ministry, with all the technical expertise, including WHO and all our partners, we had already plotted a plan to make sure that when we have got such cases, we respond adequately. So about 2 weeks ago, I had already sent my team on the ground, the team from the Ministry of Health, the State Ministry of Health, combined with WHO, UNICEF, and everybody else involved in the response. And we sent them to this hotspot. And when I send the team, we send the team with some of the resources, what we call RPDs, that is diagnostic, tools. We send them. Then we also send cholera kits. We also send some health necessities that are needed in that area. So at the moment I'm speaking with you, I have got team station on the ground. I have got a little bit of supplies on the ground, but more is needed because as I mentioned, I'm experiencing high volume of people coming into the country with limited resources.
South Sudan government is struggling with its own financial issues, and partners who are on the ground are also experiencing issues with the donations. I mean, it sounds like this particular situation is happening at a time when resources are mega or very little to help the ministry respond effectively.
John, what you have mentioned is very correct. And I want to say that South Sudan is not in isolation from the rest of the world. As you know very well, economically, the whole globe is struggling as we speak. We are almost in the verge of economic recess because we just came out of the global pandemic, COVID-19. And in particular, South Sudan has been firefighting small outbreaks and big outbreak. Right now I'm also on the preparedness for Ebola, because the neighboring countries are experiencing Ebola and Marburg outbreak. So of course there is donor fatigue. Of course, there's economic fatigue everywhere. But having said that, it is a matter of us trying to see and reprogram to make sure that some priorities are taking over other priorities. And that why, like the Minister of Health, which is like the government support, we sat down and we saw that this particular area needed more help. So we have diverted some of the resources that were supposed to be done for prevention somewhere to be taken to the response at the moment. So yes, it is going to take collaborative approach from everybody, to make sure that like we respond effectively.
Minister Yolanda, when people hear about cholera, there is panic. Malakal is closer to Renk than Juba. If you have a message you would like to deliver to the people in Malakal, what would that message be?
My message is not only to Malakal or to a Renk area. My message is to everybody across the country and most likely across Africa, because not long ago Malawi was also experiencing cholera. Zambia was also experiencing cholera. Namibia was experiencing, like the same type of disease, because it is waterborne disease. So like my message is follow the guidelines. That's number one. Number two, cholera comes from, using contaminated water mainly. So if you can follow simple guidelines, like by making sure that your home area is clean, your utilities that you use in the house, like the dishes, the beddings, and all this kind of thing is clean, and making sure that human waste are exposed like appropriately, we will be able to contain it. So my message is not only to people in Malakal or to people in Upper Nile only, but it is to the whole of South Sudan.